Hi everybody, I am Naufal. Welcome to my channel. Today we are going to discuss regarding levels of prevention. We know that the main aim of the community is prevention of the disease. Even though prevention is a single term, but the prevention of disease is done in 4 levels. We can see one by one the different levels of the prevention of the disease in the community. Okay. First level is primordial level. Next one is primary, secondary and tertiary. First one is primordial prevention. So what is meant by primordial prevention? It is a new concept. Primordial prevention is a new concept. It is the purest form of the primary prevention. Okay. In primordial prevention, risk factor is absent. That is very important. Most of the students are confused. What is the difference between primary prevention and primordial prevention? Always keep it in mind. In primordial prevention, the risk factor is absent. Okay. We are focusing on the prevention of the development of the risk factor. Okay. I will give you an example so you will get a better idea. For example, in an area, okay, in an area, no one have the habit of smoking. None of them are smokers. No one have the habit of smoking. And they are leading a very good, healthy life. Still, we are giving the education to them, avoid smoking, don't smoke, it will lead to different diseases. We know that smoking is a risk factor of different diseases, right? Here in the primordial prevention, in that area, in a particular area, no one have the habit of smoking and there is no disease related to smoking. Till now, no disease has reported related to smoking. Still, we are informing to them, avoid smoking, as well as don't smoke. In future, if you smoke means you will get certain diseases related to smoking. In primordial prevention, risk factor is absent. What is the risk factor? Our example is smoking. Smoking is a risk factor of many diseases. But in that area, no one have the bad habit of smoking. Still, we are telling them avoid smoking. Don't smoke. You will get different diseases related to smoking. Okay. So we are discouraging the children from the harmful lifestyles like alcoholism, smoking and lack of exercise, taking the fatty or the junk food. We are discouraging. We are mainly focusing on the prevention of the non-communicable diseases. So always keep it in mind, in the primordial prevention, the risk factor of the disease is absent. The risk factor is absent in primordial prevention. So in the primordial prevention, we are mainly done. The main intervention of the primordial prevention is individual education and mass education. To the individual, we are giving the education regarding the risk of the development of the disease, okay, regarding the risk factor of the diseases, as well as to the mass, also to the huge group we are giving the education regarding the risk factor of the disease as well as prevention of the development of the risk factors. Okay, prevention of the development of the risk factor. Always keep it in mind. In the primordial prevention, risk factor is absent. No one have the habit of smoking, for example. Okay. Next level is primary prevention. Primary prevention is the real or the actual prevention. It is the prevention done before the occurrence of the disease. Okay. Primary prevention is the prevention done before the occurrence of the disease. But risk factor will be present. Disease is absent. Disease is not there, but risk factor is present. In our example, here no one have the habit of smoking in primordial prevention. In the primary prevention, in that area, they started the bad habit of smoking. They started the bad habit of smoking, but they don't have any disease. Disease is absent, but risk factor is present. What is the risk factor? With our example, smoking is present. That means they started the bad habit of smoking, but they don't have any disease. Okay, risk factor is present in primary prevention, but in primordial prevention, risk factor is absent. This is the difference between primary and primordial prevention. So in the primary prevention, risk factor is present, but the disease is absent. So the main focus or the main intervention done in the primary prevention is health promotion and specific protection. Health promotion and specific protection. So what is health promotion? Health promotion means you are making a people to live a healthy life. We are making the people to live a quality and a healthy life. That is health promotion. We are promoting the health. How to promote the health? You can promote the health by health education. The first thing coming under the health promotion is health education. You can educate the community regarding the importance of the prevention of the communicable as well as non-communicable diseases, the prevention of the different diseases. Okay, you can educate the community. So first thing coming under the health promotion is health education. Next one is nutritional intervention. Due to the lack of nutrients like carbohydrate or fat or protein, due to the deficiency of the vitamin or due to the deficiency of the minerals, so many diseases will occur. So in the health promotion, as a part of the nutritional intervention, we are providing the supplementary nutrition to the target group, that is to the under 5 children as well as to the pregnant woman. We are providing the nutritional supplements to prevent the diseases related to nutritional deficiency by the state as well as the central government, like midday meal program, vitamin A prophylaxis program. Such things are done as a part of the nutritional intervention coming under health promotion. That is the second thing coming under health promotion. First one is health education, second one is nutritional intervention. Third one coming under the health promotion is environmental modification. We know that from the environment also we are getting so many diseases. So some changes we have to do in the environment regarding the safe drinking water supply. If you provide the safe and the neat and clean drinking water, means you can prevent so many diseases, as well as prevention of the noise pollution, prevention of the water pollution, prevention of the air pollution also can prevent the diseases, as well as proper drainage system, the waste and all proper drainage system is there, we can prevent so many diseases, and we have to keep the environment neat and clean. That is coming under environmental modification. Next thing coming under the health promotion is lifestyle and behavioral changes. Due to the lifestyle also so many diseases occurring. For example, alcoholism, as well as smoking, lack of exercise, taking the junk food. Okay, all these things will lead to certain diseases. So in the lifestyle and behavioral changes, we are encouraging them to take the proper diet and avoid smoking and alcoholism, do exercise, proper rest, proper sleep, as well as regarding the proper balanced diet also we are informing. Through this also we can prevent so many diseases. That is coming under health promotion. Okay, the intervention of primary prevention. In the health promotion, mainly the things are health education, nutritional intervention, environmental modification, and the lifestyle and behavioral changes. Okay, next one is specific protection coming under the primary prevention. Next intervention is specific protection. How we can achieve the primary prevention? Through the specific protection also. So under the specific protection, the main thing is immunization. Okay, through the vaccine, through taking the vaccine also, we can protect so many diseases. So vaccination or immunization is an important part of the specific protection, as well as protection from accidents. While riding a bike, wearing a helmet, you can protect from accident. If the children are there in the home, the medicines and the sharp instruments you have to keep away from the children. We can prevent from some accidents, as well as protection from the occupational hazards. Protection from the occupational hazards, that is in the job setting. Okay, the community people will work in different areas, so there is a chance of exposure to the chemicals in the factory or in the industry, as well as exposure to the bacteria, virus and all the microorganism if they are working in a farm and all. So what we have to do to protect from that occupational hazards, that is related to the job, we have to tell to them, if you are working in such area, you have to wear the mask, you have to wear the gloves, regarding the safety shoes and all, you have to give the information. So we can protect some diseases related to the occupational hazards, as well as protection from carcinogens. Carcinogens means the cancer forming agents, okay, due to the infrared as well as ultraviolet radiation. So we have to tell to the community people that avoid the exposure to such radiations. These are the things coming under specific protection. Protecting the disease by immunization, protection from the accident, protection from the occupational hazard and protection from the carcinogens, that is the cancer forming agents. Clear? Next, prevention. So regarding the primary prevention, it is the action taken before the occurrence of the disease. Keep it in mind, action taken before the occurrence of the disease. Disease is not there in primary prevention. Now secondary prevention. So in the secondary prevention, okay, disease is present. Disease is present, but the disease is in the first or in the early stage. Okay, disease is in the first or in the early stage. So the action taken to halt or to stop the progress or to stop the development or to stop the growth of the disease before moving from the first stage to the second stage, the action taken to halt or to stop the development or the progress of a disease, that is secondary prevention. With our example, here there was no habit of smoking in the primordial. In the primary, they started the habit of smoking but no disease. In the secondary prevention, due to the smoking, now they got BP, that is high blood pressure, hypertension. Now they are hypertension patients. Okay, increased blood pressure. Now they are patient, but the disease is in the first stage. So what you can do in the secondary prevention? Mainly early diagnosis and treatment. Early diagnosis and treatment. Early diagnosis means early identification of the disease. In the secondary prevention, the intervention is early diagnosis, that is early identification of the disease. As soon as possible, we have to catch the disease early. Okay, otherwise it will move from the first stage to next stage. Okay, so early identification. How to identify early? Through the medical camps, through the screening programs, through the regular checkup, through the regular examination, through the different medical programs. From there, we can identify the disease of the community people. So early identification or early diagnosis is very important in secondary prevention, as well as treatment. As soon as possible, we have to start the treatment to prevent the disease from the progress of the disease to the next stage. We have to start the treatment also. So early diagnosis and treatment are the main thing coming under the secondary prevention. What is secondary prevention? The action taken to halt or to stop the progress of a disease. Okay, no smoking, smoking, and here now they are BP or the hypertensive patient, they have hypertension. Okay, last one is tertiary prevention. Okay, tertiary prevention is the last prevention. So what is tertiary prevention? In tertiary prevention, the disease is in the late stage. Okay, the disease is in the late or disease is in the last stage. Still some kind of prevention is possible. That is tertiary prevention. With our example, no smoking, started smoking, hypertension. Now due to this hypertension, due to increased blood pressure, the person got stroke attack. Okay, now he got a stroke due to high blood pressure. Okay, in the tertiary, the disease is in the late stage. Now he got the stroke. One side of the body is paralyzed, one side of the body is not working, one hand and one leg is not working due to the stroke attack. Okay, so some kind of prevention is still possible. That is tertiary prevention, but the disease is in the late stage. Okay, so the main focus or the main intervention of the tertiary prevention is disability limitation and rehabilitation. Disability limitation and rehabilitation. So what is disability limitation? Disability means inability of a person to perform certain activities. Okay, inability of a person to perform certain activities. Now due to this stroke, that person can't walk, one side is paralyzed, so it is a disability. Now we have to limit this disability. Okay, how we can limit? Through the medical treatment, through the medicine also we can limit. Now stroke patient, with our example, stroke patient, we have to give the medicine, as well as we have to give the physiotherapy, different therapies to prevent from further problems, further complications. Okay, now in the disability we are giving the medicine. If you are not giving the physiotherapy, again the hand and the leg will be stiff, again his condition will be worse. Now in future he can't walk at all. So what we have to do? We have to limit the disability. So the main focus of the disability limitation coming under the tertiary prevention is to halt from impairment to the disability and from the disability to the handicap. Okay, the main focus of the disability limitation is we have to halt from impairment to disability to handicap. Okay, impairment to disability to handicap, we have to stop. Okay, first it will be an impairment, from the impairment it will move to the disability, from the disability it will move to handicap. So we have to halt here, or from the impairment itself we have to try to stop before moving to a handicap. So what is impairment? Impairment means any loss of the physiological or the psychological or the anatomical structure or function. Any loss of physiological or anatomical or psychological function. So loss of the working of one side of the body, it is an impairment. Okay, loss of the functioning of the leg, loss of the functioning of the leg. Okay, it is an impairment. Loss of functioning of the leg is an impairment. So what is disability? Inability of a person to perform certain activity. That means in the disability this person can't walk. Okay, due to the stroke, loss of function of the leg, it is an impairment. So what is disability? Due to this impairment, he can't walk. It is a disability. Before moving the disability to handicap. So what is handicap? It is a disadvantage from impairment or the disability. It is a disadvantage, not an advantage, disadvantage from impairment or handicap which lead a person to difficulty to fulfill the need of the society as a normal individual. As a normal individual, this person now can't perform or now can't fulfill the duty of the society. That means he can't go for the job, unemployed. Okay, now he is a handicap. Got it? Loss of leg is impairment, not able to walk is disability, and due to this disability and due to this impairment, now he can't perform the or he can't fulfill the need of a society as a normal individual. As a normal individual, this person can't fulfill the need of the society or the community. So it is handicap. Now due to this he is unemployed. He can't go for the job. He can't walk. He is paralyzed. He is in the bed only. So the disability limitation mainly focus on trying to stop from impairment. Loss of leg, anyway we have to treat before he can't walk. Again it moved to disability, he can't walk. We have to give the treatment, we have to do the physiotherapy. If you are not doing, he will be a permanent paralyzed, so unemployed. So before moving to the handicap, the action we are doing, that is disability limitation. The disability limitation, what we are doing, we are giving the treatment and we are giving the different therapies before moving to a handicap stage. Got it? That is disability limitation. Next one, next intervention coming under the tertiary prevention is rehabilitation. This word is very familiar to you, rehabilitation centers. So what is rehabilitation? Rehabilitation means restoring the health of an individual so that he can lead a independent life. You are restoring the health of an individual. You are restoring. Earlier it was there, good health was there. Now he can't walk. So you are trying to bring back that patient how he was earlier, how he was in the primordial or in the primary or in the secondary level. He was ready to walk. He was able to walk, right? So you are trying to bring back that person to that stage. That is restoring. Restoring the health of the individual, all the health, the physical or mental or the social or the psychological health you are restoring so that he can lead a independent life. Otherwise, this paralyzed person is a dependent to others. We are trying to bring them from the dependency to the independent stage. So what is rehabilitation? Restoring the health of an individual so that he can lead a independent life. So in the rehabilitation also we have medical rehabilitation through the medical treatment, physical rehabilitation helping to walk and all, okay, as well as the vocational rehabilitation related to the job. Earlier he was a skill, now that skill has gone due to the stroke, so we are training them. Again you can do this with the hand and with the leg, okay. So we are doing with the vocational training as well as psychological, mentally some problem will be there. Through different therapies we are trying to bring back the psychological level of that person. That is rehabilitation. That is regarding the levels of prevention. Always keep it in mind: primordial, primary, secondary and tertiary. Primordial means risk factor is absent, not at all, they don't have any habit of smoking, risk factor is absent. Here in the primary prevention, risk factor is present, smoking is there. I am just giving the example only with smoking. Smoking is there, but disease is not there. In the secondary, disease is there, but in the early stage, that is hypertension is there, but it is in the early stage or the first stage. Now in the tertiary, it is the late stage. Stroke has occurred, stroke attack is there, still some kind of prevention is possible. So don't get confused with primordial and primary. Risk factor is absent, risk factor is present. Got it? That's all regarding the levels of prevention. We will meet soon with another video. Till that time, thank you and goodbye.